Hi, my name is Dr. Christy Prowse of the Institute for Hormonal Health, and I really wanted to share with you today an organization that is near and dear to my heart, and that's the Hamlin Fistula Ethiopia. This is an organization that's been around since the 1970s and started by an Australian obstetrician gynecologist husband and wife team, the Hamlins. And they went off to Ethiopia thinking that they were going to be there for the short term. It wasn't short term for them. They took upon themselves to create this organization and hospital that has touched many, many, many women's lives. A fistula is an injury that happens during childbirth. Unfortunately, when a baby's head can sit in the pelvis for many days without being delivered, the pressure of the head in the pelvis compromises the blood supply. And what happens there is that some of the tissues die, and that can be tissue of the rectum between the vagina as bladder and vagina as well, so that there creates a communication. And these women with a fistula can leak feces and urine uncontrollably. And as you can imagine, they are often dismissed. Their husbands leave them, their communities ostracize them, and they've got these medical injuries that are catastrophic, often a dead baby that goes along with this. And so there's a whole constellation of symptoms that happen and fallout that happens from this. So the Hamlin Fistula Hospital takes these women on. They perform these incredible procedures that are sometimes quite complicated and restore their physical health. But just as importantly, they take on dealing with the emotional and the spiritual aspect of all that comes along with these catastrophic injuries. I had the pleasure of heading to Ethiopia last October 2017 with a few of my colleagues, and had an amazing time and was unbelievably impressed by what the Hamlin Hospital was doing and that the facilities that they had there. A tidy, complete hospital unit that was sitting amongst beautiful forests and flower gardens. Dr. Hamlin herself, who's now 97, that was her desire, is to bring the English garden to Ethiopia, and she certainly did that. There was such an unbelievable feeling of just contentment throughout, and you could tell that these women, although they didn't speak English and there wasn't a whole lot of communication, they were just really pleased to be there, and they were all enjoying one another's company. They were learning skills that they could take back to their communities. I purchased some necklaces that were made, some little jewelry dishes, and I was very impressed at the truly holistic approach they were using to treat these women. We met with the chaplain on site. We met with some of the nurses and the physiotherapists, and just talk about an amazing facility just on the outskirts of Addis Ababa. And there was stark contrast between this major city and this beautiful little oasis on the outskirts. I really can't say enough about it. It really is an organization that I am behind now and plan on being behind for a long time. So come and join us and help lots of women that need our help, because it's not just something of the past. This is something that is ongoing, and it's not just Ethiopia either. It's a lot of these developing countries where these women are struggling.
So, what I saw in these women's eyes was not just that. It wasn't just pain, but more importantly was the hope, the courage, the faith, and this sense of community that was palpable between these women. It was really such a beautiful experience for me to be a part of. And this foundation, the Hamlin Fistula Ethiopia Foundation, is what's making this possible. They've created a safe space for holistic healing, and it truly makes me happy to know that there are organizations out there like this that are making a positive difference in the world.
Hi there, my name is Janine Bergsma. I'm a registered nurse. I had the opportunity to go with the team to Addis Ababa, Ethiopia, and visit the Hamlin Fistula Hospital. And it was a really humbling experience. I'd just like to share a few things with you about what I saw, what I felt when I was there. One of the things that really resonated with me was walking into the hospital ward and seeing the beds all set up and knowing that the the atmosphere in the hospital there was such a peaceful environment in amongst this busy hub of a city in Africa. To walk into such an oasis and just feel the peace and quiet and serenity in the space that they had there, overlooking the river, was really amazing. It was really incredible to see how a hospital ward functions in Africa. We took a little peek into the operating room there, and just know the impact that the surgeons, the nurses, the medical staff, the therapists, right down to the staff that were cooking for the patients there had on each of the women that were there. They were explaining to us that the patients that come in sometimes need up to 2 months rehab before they're stable enough to even be operated on. And that sat with me as I just thought about how the terrible condition that some of these women come in from the outskirts villages, from their communities, and for them to have to be stabilized for 2 months before they could operate. It was so amazing to see how they work with all the different healthcare providers there to rehab and to get women back on their feet, get them financially stable. And even one of the sections at the hospital, I think it's actually a separate facility, housed a midwifery school. So not only are we looking at treating and surgically helping women with the fistulas, they're also now bringing in a whole generation of midwives that can now go out to their satellite units in all the various parts of the country and help women have shorter childbirth and help women as they're going through the birthing process to prevent fistulas, because really that's part of the whole process of this. The whole experience at the hospital was really incredible. I felt like as I looked in some of the women's eyes, couldn't communicate with them, couldn't speak their language, but from woman to woman, that we could look at one another and I could actually see and sense hope, from a devastating situation where they've lost everything to a situation of hope where they had something to live for. And even though they might have come out with even some physical disabilities, certainly emotional disabilities and wounds, that they could move forward and be integrated back into society where they're loved and cherished, as all of us as human beings should be. Thank you.